Hello, my name is David Harville. I am a licensed professional counselor working at New Life Counseling Center as a clinical director. I've been a counselor since 2014, and I've been working at New Life for the past almost 5 years. Imagine yourself with a shovel digging a hole. You dig until the ground beneath you gives way. You fall into inky blackness onto the muddy surface of a cave, miraculously uninjured. The only light that you have is high above the entrance to the hole, and the only tool you have is the shovel. You try to find a way to use the shovel to get out of the hole, but shovels are made for digging. So all you accomplish is making the hole deeper and wider. Exhausted, frustrated, you throw the shovel down and sit down in the mud. Illuminated by the dim light from above, you are out of options. You cannot dig yourself out of the hole that you dug yourself into. You realize that you need help and cannot get out on your own. This is the picture of addiction. So, what is addiction? The DSM 5 defines addiction as a chronic, relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. Addiction changes parts of the brain involved in reward, stress, and judgment. While the initial decision to use drugs is voluntary, the more a person uses drugs, the less that person is able to control his or her drug use. The addict chooses to dig the hole, encounters unforeseen consequences, and gets stuck in that hole, unable to get out on his or her own, despite his or her best efforts. So, why use drugs? Reasons for use can include stress, social pressure, curiosity, better performance, feeling better. The risk factors for drug use being genetically predisposed, mental illness, aggressive behavior, lack of parental supervision, passivity, use of substance at an early age, availability of drugs, and poverty. Preventive factors, parental supervision, positive peer pressure, academic achievement, lack of availability of substances, community resources, and awareness of harmful effects. Now, the consequences of drug use. Short term consequences include anxiety, depression, confusion, insomnia, paranoia, aggression, nausea, constipation, injury and accidents, death, employment problems, and legal consequences. Long term consequences: cancer, stroke, heart disease, liver disease, nerve and brain damage, dental problems, birth defects in newborns, asthma, bowel decay, and relationship injury. Note that those who begin drug use early in brain development, like childhood, teenage years, delay or stall growth in areas of the brain affecting judgment, emotional regulation, and compulsivity. Cross addiction. Sometimes an addicted person will offset the use of one substance with another, like alcohol, a depressant, with cocaine, a stimulant. In time of abstinence from one substance, often the addict will use an alternative to achieve the same or a similar effect, like alcohol and marijuana. Co-occurring disorders. Any addicted person who suffers from mental illness has a co-occurring disorder. Mental illness can make a person more predisposed to drug use or self-medication through non-prescription means. While mental illness can make the addiction worse, often the addiction makes it more difficult to cope with the mental illness. Co-addiction. A co-addict is anyone who is close to an addict and is affected by the addiction. The parent, spouse, caretaker, family member, friend is not an addict themselves, but they have done something to adapt to the addict or addiction. Sometimes it manifests as enabling the addict in order to keep that person safe. Other times, the co-addict goes in the opposite direction, completely alienating the addict. So, talking about it. With children and adolescents, it is important to address addiction. Ideally, the conversation should take place before the child is exposed to drugs and alcohol. We should be honest about addiction and how it affects us. Keep in mind, our actions and what we model to our kids is more important than any words that we say. Most long-term addicts begin using drugs and drinking alcohol at a young age. Many simply had easy access. Many were introduced to drugs and alcohol by someone in the home. If we have to confront a loved one about their addiction, it is important to have a gentle but firm approach. Try to view the addiction as an illness instead of a flaw in character. This helps us view the addict as sick and in need of help. Avoid condemning or judgmental statements. Express concern and set healthy boundaries. The addict may deny having a problem or give assurances that he or she is managing their use. We may need to ask for help from another person who has a loved one in recovery, or we may need to consult an expert in addiction like a counselor or a physician who works or has worked with addicts. So how do we get help? Addiction is treatable but cannot be cured. Do not despair. If you suffer from addiction, you are not alone and help is available to you. Some substances such as alcohol, benzodiazepines, and opioids require detox, as withdrawal from these substances can be painful, dangerous, and even fatal. However, detox is not treatment. Some medications can help in treatment, especially when used in combination with behavioral therapy or counseling. Treatment programs for substance abuse include inpatient, intensive outpatient, and outpatient. Inpatient substance abuse rehabilitation programs recommended for moderate to severe addiction provide 24/7 care for patients who live on site for a period of time, utilizing group therapy and individual counseling. Intensive outpatient programs recommended for mild to moderate cases provide therapeutic groups 3 to 5 times a week, while outpatient groups or individual counseling meet once a week. New Life Counseling, where I work, provides outpatient treatment in the Lafourche Parish, and there are several other options for intensive outpatient and outpatient treatment in the area as well. There are multiple inpatient programs available in the New Orleans and Baton Rouge areas. Also, 12-step meetings such as Alcoholics Anonymous and programs such as Smart Recovery. Those who prefer a faith-based approach may want to use Celebrate Recovery. A number of helpful resources can be found online at nida.nih.gov and samhsa.gov as well. I know that asking for help or even admitting that you have a problem is difficult. I know from personal experience. I've had a hard time asking for help myself. But the bravest moment in my life came when I had to admit that I had a problem that I could not fix on my own, and I finally asked for help. Doing so changed the course of my life and changed it for the better, and I am continually grateful for the changes that I have made and the changes that I continue to make in my life. So please don't be afraid to ask for help.